in this episode of Horse Shelter Heroes.
So we're gathering everybody up because Caitlin has something she wants to say. So there goes Lily, Baron, and Walter.
Vet team has some really sad news to share with you guys about Honey.
Construction is going to start in about a week. The contractor's telling me.
I think Team 1's got to get a pie in the face.
You don't want to miss a single second of Horse Shelter Heroes.
Welcome back to Horse Shelter Heroes. I know you've been missing it. I've been missing it. It's been a little bit since we released the Horse Shelter Heroes. And why is that, you might be asking? Because we switched over to Horse Plus Happenings, a daily vlog of what's been going on here at the shelter every day we're open. It's been awesome. People have loved watching them. But if you're like me, you're very busy and you don't have time to watch 45 minutes to an hour and a half every day. But that's where Horse Shelter Heroes steps back in. It's the weekly highlight of what happened in the vlogs, condensed into a shorter version for you, so that if you only have time to watch one a week, watch this one. Because all the good stuff is going to be in here, so don't miss a single episode of Horse Shelter Heroes. If you do have time to watch the daily vlogs, this is a rerun. You've already seen it. There's nothing new. But if you don't have time to watch every daily vlog, this is a way to keep up with what's happening here at Plus Humane Society without as huge of investment of time as our media team giving it their all.
Hey Caitlin, what are you guys going to be doing?
The vet team have come up to quarantine today. So it's been over a week since our buyout. So we normally like to come up and recheck animals, check for happiness, because by now they should all be getting fat and happy. Last week we came up and one of the horses just looked really dull and depressed, even on a 10-acre pasture of grass. So we're coming back up to recheck her and the other horses today, just to make sure that we didn't miss anything, one, but two, sometimes some horses need a little bit more love than others. We're just kind of gauging, now that everyone's calmed down, what we do and do not need to do to get all of these horses to adoption.
Yeah, she doesn't look like she feels very good.
Yeah. Oh.
Caitlin's getting temperatures.
A little high. Are you anxious? It's 101.2, which is technically within normal limits, but that's like the last of the normal limits. Hi. Oh, that's a great temperature. How was Floppy Lips? Yeah, that's the one I got. I didn't get you.
How's everybody's temperatures?
Everyone looks good. One of them's a little bit warm, but not too bad. She's so cute.
Little hugs. Little huggies. Giving all the loves. They're worried about Cameo over there. She just seems depressed.
Vet team is all done looking at the 6 horses that we currently have in the 10-acre. Everyone's looking great today. We're still a little concerned about the buckskin mare. She's very pretty. She just seems really down, whereas the other horses they're feeling real good and they're real happy. She just seems kind of dull and depressed. She just looks like she doesn't feel very good. I'm not sure what we're going to do yet. Might do some diagnostics, run some blood work again. She's just kind of really sad. Everyone else is fine. Waffles is living his best life, his big old best life. So since we're done with this, we're going to go look at a few of the other horses here in quarantine. And then we had a few horses in Gen Pop that had diarrhea or like random little things. So we're going to recheck them today. Then later in the day, we're going to be doing next HA on Lily. For right now, that's all we have here at Horse Plus. Things pop up everywhere, so we'll see.
So we have an adoption appointment here today. They are interested in Lily as a beginner horse, so I'm going to go grab her and then they get to meet her.
This is Lily.
Hey, look at Billy's
Aw, hi, sweet girl.
And she just got her tootsies done on Wednesday.
Wow.
Oh, she looks so much better. She's had a few choking incidents, which is something that the vet team and us have to watch for with refeeding, because she was so thin. So she's been on soaked feed for a little bit, but she's doing wonderful. She hasn't had an incident.
Oh my goodness. Who are these strangers?
Oh, yeah, she is 19. You want to pick your foot up for him? Show me, pick up your footsies. Can I see? Can you stand properly, please? She's like, no, come on. Oh, good girl. I know you're standing funny. Being tied and then walked away from, she will have attitude and she'll paw at you.
Yeah, we have one of those. Even in cross ties, he's like, excuse me.
Yes, we see you.
Who's that?
That is Baron. He is also a very sweet gentleman. He's blind in one eye.
He's so handsome. Hi, buddy.
Dragonfly running into you.
And he's not spooky on the side he can't see out of either.
Oh,
so he's a good boy.
hi. Are you being swarmed? Are you being swarmed? Yeah. Where's your spot? We know you got a spot.
Mount the tail right here to keep it.
She's got thick fur.
Oh, she was big. Do you think she came from Big Lick?
She was a big lick horse, yeah. Her tendon was cut and stuff.
Is she getting her winter
So I've
clothes?
been. She's watched the videos a lot. I haven't.
Yeah. And she walks a little funny because she, if that's cut, she at one point did have stacks on her feet. But she's still a pretty good girl at heart.
Yeah, you are.
On her neck, she has a lump. What this lump does is it basically is putting slight pressure on her esophagus. We don't know what the lump is.
And that's the softened food.
Yes.
Okay.
It is getting smaller.
Oh, wow.
So whatever it is, like we've done x-rays and ultrasound, we don't know. But it doesn't seem to be
painful
in any way.
She does have a tendency with her long, lanky legs to sometimes accidentally kick you in the back of the foot.
Oh, okay.
Yeah.
Well, and they don't love gravel.
Our horse hates walking on gravel.
I know, he avoids it at all costs. We're going to put a pad on you. Hi, sweet girl. Aww.
All right, so as well as being interested in Lily, they're also interested in Baron. So Caitlin is bringing him over here so that they can look at him as well.
Is she a little taller than Bro?
Oh, yeah.
It is kind of crazy watching her movements. It's like so still compared to.
Quarter horse. Oh.
Oh,
Yep,
yeah.
I'm famous for that. It's much smoother. She's also just so much, longer backed. Thank you, Lily.
All right, so are we adopting Lily today?
What do you think?
What you think? You want to take her home?
Yeah. We'll take her home. Oh, and everyone is so sad.
We're also happy.
We're only 6 hours north, and you can have our address.
I'll have an amazing horse.
1, 2, 3. Oh, I love it.
Oh, you may come home.
She looks so small with people huddled around her. You can't tell how tall she is. Oh, that's right. You're seeking Arthur. That's who you are. Yep, that is his registered name. He was born in Florida.
Where are you going? You want to walk? I told you we'd come once a month. Yeah, he's not jumpy. He's not a jumpy.
So are we taking Mr. Barron home too?
We are. Yay.
Oh, Mr. Handsome.
What do you think, Evelyn?
I think he would be pretty well with Brody. I mean,
He also really likes the boy horses too, and he looks a lot, and Baron looks a lot like Elliot.
This is okay. I like it.
He's not big on eyelashes, you know.
Oh my goodness.
Lovely, luxurious eyelashes.
And your whiskers. I mean, come on. Oh, he's a sweet boy.
All right, 1, 2, 3. Aww. Big cheesy grins.
Oh my goodness. He's like, but I want to.
I want to go to your head.
Oh my gosh.
He's a bird.
He'll play with you. He'll jump at you sideways. He's very entertaining.
You like Walter?
Every time I use it.
Larry is so cute.
Those teeth are super sharp.
Walter! No more getting jumped on.
Oh, you've got such crazy eyeballs.
He's like, noise.
We found Horse Plus on YouTube last Christmas. We figured out because it was the holiday adoption event, and we have watched every video since. And we rescued our first horse locally back in the spring, and we knew we try to rescue when we get new animals. So we knew when it was time to add more horses to the herd, we were going to drive out to Horse Plus.
So we adopted Lily and Baron, okay, and we adopted Walter. So Lily and Baron are horses. This mom like really wanted them. It's like she like instantly bonded with him. And then the Walter, the kitten, he's really playful, and I thought he would be really good playtime boy.
How excited are you?
I'm really excited, really.
That's awesome.
It was a great experience, and I think we took Lynn by surprise too, because I think she was thinking we were coming tomorrow. Is that true?
Tomorrow?
I think she thought we were tomorrow. It was great. It was great. They were just so patient, let us really get to be near and jump on the horses. And I like that they want to make sure that we're a good fit, and we want to make sure that the animals are a good fit so that it's just a forever home and they don't have to move again. So, okay, who did you want to grab? I don't know.
Who wants to take Baron?
I'll take Baron. Oh, you want Baron? Or you want Lily?
Okay.
Lily.
Oh!
Okay, now you're
Sweet
gonna
boy.
put him over there on that wall. You guys are the first ones to use this.
Do you want us to go higher? It doesn't matter. Okay.
Walter.
Yay.
Look at all the babies. Good job, Benny. Very well coordinated. Yay!
Okay, so one more time.
One more time, Emmy. Yay! Different goodies, I don't know.
Got Walter, Baron, and Lily all adopted. Okay, now it's time to load Lily and Baron. Let's go. Hi, Lily. Hi, sweet girl. They are all loaded up. There goes Lily and Baron and Walter. So we're gathering everybody up because Caitlin has something she wants to say. So we're having a little meeting in here.
I'm a blabbermouth. I cannot keep a secret. I actually have a very big surprise. I am pregnant. Me and Corey are pregnant. Yes. So, with that being said, I also have another surprise. I found out the gender of the baby. And I will be having a boy.
Congratulations.
I did. Corey already knows. I made sure I told Corey and my family before I told you guys. But everyone knows that needs to know, and now my other family knows. So.
Congratulations.
Thank you.
Vet team has some really sad news to share with you guys about Honey, the little donkey who came in during a seizure / she was voluntarily surrendered back in August. Honey came to us in really, really horrible shape. She had wounds over most of her body. She had maggot infestations in some of those wounds. She was lame on at least 3 of those legs, and then her right ear was severely infected. She had kidney and liver value elevation and just a lot of other major concerns. She was borderline obtunded and not very responsive. So we've spent a ton of time with Honey and nursed her back to health. Her blood work improved. And she was doing very, very well. We actually had cleared her for adoption. And then unfortunately, last week, Honey presented acutely with a grade 5 out of 5 lameness. So she was basically non-weight bearing on her left front foot. Honey had horrible club hooves, so her conformation was very poor. We know there was some degree of inbreeding. We don't know how severe the inbreeding was, but we had taken radiographs on all of her feet and seen some really significant radiographic changes even when she first came in, but clinically she improved a lot. And so that's the big key for Dr. Gina and I is your quality of life has to do with your clinical health. We treat the patient, not the diagnostic. So the radiographs were pretty bad from day one, but she showed so much of a fight still and so much clinical improvement that we really fought through.
On Wednesday last week, she was, like Dr. Lydia said, 5 out of 5. On a lameness scale, we do it from 0 to 5. 5 out of 5 is non-weight bearing. She was very painful, non-weight bearing on her left front. So immediately I knew we needed to get pain management on board, sedated radiographs because she doesn't really like us very much. I don't blame her, but so that was the first thing we did was give her pain management and sedate her and then take radiographs. And comparing her left front to her right front, because you always want to take bilateral radiographs to compare to see, is this all legs or is it just one? Her left front was significantly more radiolucent on the radiographs than her right front, which is also a red flag, which means her bone is not as dense on the left front. And then when we really honed in and blew up on the image what her coffin bone looked like, there was a lot of resorption or lysis of that bone on the coffin bone. So she's bearing, equids bear 60% of their weight on their front limbs and 40% on the back. And so if there's any problem in that apparatus anywhere, it exacerbates the problem. And so when you're looking at the radiograph, her bone is being eaten away by some operation, either inflammation or something infectious, something like that. And so that apparatus is breaking down. And on the radiograph, if you look at it, there is so little bone there that the whole column is coming down to a point, even more so than normal on horse conformation, and especially compared to the right. So looking at that, it's a really big concern when you see those changes that there's potentially going to be a pathologic fracture, like one of the horses we had on intake had a pathologic fracture of the coffin bone, which isn't very common, so that's a pretty severe issue. And even with aggressive therapy, like digging out whatever's going on and giving her regional inperfusions and things like that, quality of life, and then long term, will she rebound from this? Once that bone has gone to that point and she was that painful, aside from putting her into like a veterinary hospital, like a teaching hospital or a major facility where she'd be under 24-hour care, even then with that much care around the clock, her prognosis was very, very poor. So the thought of putting an animal that's already had a lot happen in her life, that doesn't really like people too much, and is in that much pain with that poor of a prognosis, the thought of putting her through all that just because we could was not really, that's not really what we're supposed to do. We're supposed to advocate for the animals and their quality of life and their level of comfort. So we gave her the pain meds and we put a poultice on there just in case there was a tract. I left that out. There's a tract at the point of the frog. And if you look at horse anatomy or equid anatomy, that is not a common place for an abscess to blow out, because they usually blow out at the point of least resistance, which is usually the coronary band or a point in the lateral sole. not at the point of the frog, and that is directly correlated to the point of the coffin bone. So whenever you see an abscess there, it's a red flag to think that there's something going on between the coffin bone and the sole. So based on her conformation and what we saw in the radiographs, we think there was some kind of either anaerobic or other type of bad juju, to put it in layman's terms, happening around the coffin bone. And with the conformation of her being club-footed and upright, there's a lot of tension pulling that coffin bone back from the the flexor apparatus. And because of all that, that's why it ruptured out there. But that penetrating tract was very deep, and we were concerned if it was something from the exterior going interior. We didn't want to put anything in it that could potentially go into the coffin joint or the coffin bone and make it worse. But after radiographs and looking at it post-mortem, it was something interior coming exterior. So at this point, there was nothing we could do to really help her feel better.
The family who was going to adopt Honey and Nancy together is still going to take Nancy home. But Honey went from being completely checked out and just terrified of people to, she didn't like to be caught or handled, but I would go eat my lunch in her stall a lot of times and she would eat out of your hand. And I think she felt safe and loved here. And I'm thankful that we did everything we could. Her ear healed beautifully. And it's really heartbreaking. And it's hard to share these stories, but we do it because we want to educate people about how to care for their pets appropriately, but also educate people about these sad stories so that we can do more as an organization to help prevent things like this from happening. We wanted to update you guys on the result of Winston's tests. If you followed Winston's story, it was very heartbreaking for our team. He came to us as only a 6-year-old. He was microchipped to the Jockey Club. And we actually were able to track down one of his former trainers. He was just an absolute sweetheart, and he was mostly healthy with us for over a month. And then he started developing rapidly progressive neurologic symptoms. So we do have the results back from those tests, and as is the case often in medicine, the results are a bit vague and can be open to interpretation. But to the best of my knowledge, we do have some answers. So Winston tested positive for 2 different diseases, both of which can cause neurologic disease. EPM, which is equine protozoal myelencephalopathy or myelencephalitis, is a hard one because you have to pair the levels in circulation as well as the CSF, the cerebrospinal fluid. And so his EPM levels were weak, and the lab's description for that was either the pathogen load was below detection or the isolate was a rare type, that the test wasn't as good as finding. So that was a positive. Whether or not that was a clinically relevant positive, we don't know. But Winston also had strongly positive IgG, which is a type of immunoglobulin, to West Nile virus. West Nile is something that we vaccinate for here at Horse Plus, and Winston did receive 2 vaccinations against West Nile. But the IgG normally doesn't stay elevated for more than about 10 or 12 days after vaccination. And Winston's second West Nile vaccine was administered on September 10th. And then his IgG results from October 10th were still very high. So the lab's interpretation was that Winston was definitely exposed to West Nile virus, but whether or not they were willing to say that he had active disease from West Nile virus, they weren't committing to. Dr. Gina and I just we have a sample of his cerebrospinal fluid, and also noted that there are particulate matter in that CSF. So that fluid should always be very clear and without anything present in there. But there shouldn't be anything in this sample. And see, when you rotate it, you got some little floaters swirling right there. So that is abnormal. Dr. Gina and I do actually a fair number of CSF taps. And so we're pretty good at getting a non-contaminated sample. I'll swirl it again so you can see those little, whatever they are, floating around in there. See the little particulate matter floating all around in there.
Oh, yeah. Yeah.
We didn't send for all of the possible tests with Winston. We're an animal shelter. In Winston's case, his clinical signs were heartbreaking. He could barely move. He was shaking. We weren't able to manage his pain. So our big goal as clinicians was to make sure that Winston didn't have a disease that put the rest of our horse population at risk. So we didn't do some of the other tests that we could have done on these samples, like we have in some other cases. But in my opinion, these two positives do indicate that we made the right call. We knew we made the right call without these, but that Winston had something significant going on, that the likelihood of successful treatment wasn't high with the degree of his clinical signs anyway. So just wanted to share that information with you guys. If it sounds like there's always a caveat, it's because pathologists love to put a caveat on those results.
So before going to High Forest, we stopped by where the new spay and neuter clinic is going to be. So we're checking on progress over here.
Construction is going to start in about a week, the contractor's telling me. Originally, there was a building right here where I'm standing that was going to be vamped to be the spay neutering clinic, like just revamped. And ultimately, it was such an old building, we just had to remove it. Originally, the building was going to be a 50 by 50. And now, because of the way it was lined out with the trees and whatnot, it's going to be a 40 by 60. So basically, the size of our office, our main office at Horse Plus. We've been discussing a lot, and I had a meeting with the vets this morning, and we're trying to build this the absolute right way. And because it's a spay-neuter clinic, but it's also where all the dog and cats will be. The dogs won't be living in this building. There'll be another building for the dogs. So they'll be able to get fresh air and then have a nice area to go in where it's warm. But it's a complicated situation, maybe because I've built lots of horse stuff. Just haven't built a spay-neuter clinic before. But all the buildings at Horse Plus, I designed them all, and they're all functional. So hopefully I can get this one right, but I always love input. You're all welcome to send in input too. It can get too complicated if too much input gets involved, and people that can actually be here and see what works with the land and stuff, that's very helpful too. But you're welcome to send your input along with this if you'd like. We are going to hit the road and go to High Forest and see their fundraiser. Hopefully it's going well.
Okay, we're here at High Forest. We're bringing in all the toys, and we'll be going inside pretty soon.
Hi, babies. Cutie.
We're participating in a fundraiser. I don't really know what we're going to end up doing, but High Forest is an amazing organization. We are here to support them. It sounds like we might get locked in a cage. I don't know.
For 30 minutes.
I have no idea what all's going to happen. It's fun. But I did see our county mayor come out, and he had cream all over his face, and his clothes were quite dirty.
So we're at High Forest Humane Society shelter today. We're doing a fundraiser with a group called Jordan's Way. They were here last year and helped us raise money for our pets who really need adoption, and we need to raise money for food and vet services. So we do a lot of silly things to raise money, pies in the face, we get locked in the cages. We had Mayor Keltner get a pie in his face earlier. We've had some tortilla slaps with some of our volunteers. We are about to get locked in a cage. We have some locked in a cage right now trying to get out. So anyway, just a lot of fun to build awareness about who we are and about our animals, and really spotlight those who've been here for a while.
I want to say we're really thankful to have so many community partnerships. Horse Plus Humane Society, of course, being a big part of that. It's great to see so many people here, so many people invested in this cause of caring for those furry members of our community that can't very well care for themselves. So this is a great day for High Forest Humane Society. It's a great day for the animals in our care, and hopefully we'll be able to accomplish a lot of good.
Okay, I think Horse Plus is on team 2. We're going to be locked in a cage, and we'll see what the plan is from there. So we've got team 2 going in. We're all just going to pile in, I guess. Oh, goodness. Okay, so we're all here. Oh, this is gonna be lovely. Okay, so we're all in a kennel.
Where's my team captain? Okay, stay in the front.
She's team captain.
Team 2, give me your first name. Wow, team 2 is loaded. Team 2, give me your first names. Trisha, Heather, Shay, Viper. O-Team, here we go. Keep going. Eden.
Chandra.
Sean. Angela.
Haley.
Amy, is that what you said?
Haley.
Bailey, I'm sorry, Bailey. Bailey, your team's got 30 minutes, Bailey, to raise more than $1,150 set by Team 1. If you don't raise that money, everybody gets a pie in the face here. Everybody gets a pie in the face. Here, who's my team captain? Trisha, do me a favor. Where is it? Trisha. If you're just running in, Maryland. If you're just running in, Trisha. Maryland. Trisha, hold my pee, Trisha. Hold my pee. Show the team. If you don't raise 500 in the first 10 minutes, everybody drinks the yellow snow. Trisha, you ready? You're just a bartender. You're not going to drink anything. You're just a bartender, Trisha. Let's do it. That team's got to work their phones. Trisha's not going to drink it. She's just a bartender. They got 10 minutes all together right now. It's 4:54. They have 30 minutes to Team 1. Will they take a pie in the face?
I want team 2.
14:46. Is it disgusting?
She's eating the treat.
Not too bad. Guys, give it up for my friend Deb from the Chamber of Commerce.
So Tani just donated $100.
Exactly.
And now we got a new challenge.
She's
Trying to
got her
figure.
first 30. She needs 320 more.
We are in a dog kennel at High Forest Humane Society. I've seen someone eat a dog biscuit, a bacon dog biscuit. Someone else is gonna eat a tarantula if the money's not raised, and there was urine they were going to make us drink. This is very scary fundraising. Do you want to say anything? This is Dr. Lydia's daughter.
Hi. I did this last year when they did this, and we got sprayed with the hose. We lost, we got sprayed with the hose.
So they donate enough money she doesn't have to eat the tarantula. Anyways.
Are you going to raise the last 300, Trish? I bet we are. If you guys don't raise 300, Team 1 gets to pie you in the face. Also, there, high heavy. You guys have the last few minutes. Trisha, work your team. You got this, team captain. You go.
I'm just hoping we can get this other $300 so we don't get pies in the face.
Pies in the face would be a whole lot better than drinking urine or tarantulas.
Donated twice.
Woo! Thank you!
It's going great. We are having a blast back here in the corner back here. And so we are back here in the corner holding up the wall. And we are trying to raise money here to get us out of the dog kennel. And we are having a blast doing it.
It's like some jelly bean stuff we'd have to eat if we don't raise enough too.
Jalapeno jelly beans.
This is us right now. We're on a live, and that's us in the cage with them in the front. Okay, we just got $50, another $50. We're $150 away. If we don't make that, we eat the very nasty jelly beans. There it is, the nasty jelly beans. We gotta eat those. We've got like less than a minute.
There's a Carolina Reaper jelly bean that's supposed to be very spicy. What do you think of this?
I think it's pretty cool. We got to take care of people and pets, so this is good.
Now, you ate a dog biscuit.
I did a doggy treat, bacon flavored.
How was it?
Well, I have to be truthful. It wasn't good.
Okay, we are stepping out. We're free. We are free from the cage. Good job, everybody who donated. That's awesome. This is for High Forest Humane Society. Oh no, what's going to happen? I think Team 1's got to get a pie in the face. Oh no, Megan, not Megan.
It's going to get really exciting. You guys are going to
After they pie you, I need everybody back in line. I need you to just scrape it off and deal with it for a minute, okay? So get back in line. Both teams, all right? Stay here, don't move.
Team 2 got $2,500 raised.
All right, who from Team 2 has the best throwing arm? Perfect. Here we go. Gage, stand right here. I want you to aim for the nose, Gage. You got to throw like a baseball. Like a baseball, Gage. 1, 2, give it to her.
Oh, goodness.
All right, everybody else, give me 2 steps closer. Give me 2 steps closer. On the count of 3, throwing. 1, 2, 3. High face. High face.
Perfect.
Get your face clean.
Megan's face is clean. Everybody else.
Everybody back in line.
Okay, if there's one donation, Team 1 gets to get revenge and egg Team 2 now.
40 seconds. If they don't raise it, Penelope, your team's going to get egged. If you raise nothing, it's 1 donation. Just 1. 26 altogether. Almost 3,000.
Okay, they might get egged. Okay, someone just donated $15.
Like it. Everybody else, go get it. Go get it.
Oh, Maggie. Oh, goodness. Oh. Oh, Tawny. Oh, no.
What a nice conditioner.
Oh, no. Someone's getting slimed. But we have to go back to the shelter, so they're going to do another round where Team 1 versus Team 2 for a mega round. But we've got to head out, so we're going to post the link up later today and show you guys. But even though it was a live, maybe they'll still have the donation link up. And another slime. Wow.
That'd be so cool.
It was definitely a wild fundraising event, but we have some panels getting delivered for our quarantine expansion. We're going to have to take off, but check out 4th-7th Society. I know you saw some of one of our dogs here.
Yes. It's Medusa. I saw Medusa in here. So this is where a lot of our dogs get transferred. And then they go into their adoption program, which they have an amazing adoption program.
So we're really good at getting animals taken care of and ready for adoption. And our focus is horses. So we partner with organizations like High Forest so they can do the adoption part. Because we have the medical team, the vets, everything, like get them spayed, neutered, ready for their homes. And then we work with organizations like this. So we came out to support High Forest today, but we got to get back to the shelter now before something bad happens here.
So yeah, we got to head back to the shelter, but they're going to continue doing the fundraiser. All the little doggies out here, and then we're going to head back. We noticed that they gave out some of the toys already that we brought. Do you like the toy, buddy? Yeah, they got the toys. Got the little snuggle buds. Now it's time for treats.
They're bad behavior. There you go. Good girl.
Not so bad, huh?
Yeah, your best friend's real nice.
So Emily brought Symphony in. The vets are going to be... Yeah, I did say your name. The vets wanted her brought in today. On intake, we noticed, or the vets noticed, that she had a 4 out of 6 heart murmur. She also has pretty significant sway back and some other things like when she walks. So we've been meaning to recheck her and kind of give her a second once over now that she's out of quarantine. We're going to go ahead and do that once the vets are ready. Until then, we're going to eat treats. And she's a little nervous, so we're going to calm her down a little bit, but she's going to be fine.
Symphony, is there anything you want to say to the people? Oh, okay. I understand. Num num num. You were giving a lot of cookies. She hears Emily shoveling her poop behind her.
Sarah said you can never say that you smell like this. Her it's 52, but
She's excited.
She's a little excited.
Yeah.
She doesn't have reactivity on palpation.
She says, oh, I get the
Should we do some butt crunches?
Some Pilates.
This adorable little mare is named Symphony. She came in through our buyout group last month. And if you'll notice, her conformation isn't the best. She has what we call a sway back. The technical term is lordosis. And it just means that her back dips pretty significantly from her withers and then kind of goes back up in her lumbar spine. In some cases, this happens with age. A lot of horses look sway back as they age because they lose muscular condition. I think in Symphony's case, this is actually her conformation. She was likely born with this. Actually, a horse who's only about 5, and his back is more severely swayed than this, and he's very comfortable doing his job as a little trail horse. On palpation, Symphony is not uncomfortable. It can be more challenging to saddle fit these guys, and we also want to be a lot more aware of saddle fit when carrying a rider. So it's something that we take into consideration, but certainly there are horses that have this condition that lead very comfortable, normal lives and are able to carry a rider. We haven't evaluated Symphony for rideability yet. She is here today because we noted that she had a heart murmur on intake. And any heart murmur, grade 3 or above, sometimes we can make a decision without advanced diagnostics, but based on our kind of cardiac workup algorithm, any heart murmur that's grade 3 or above should have a scan. So our wonderful new ultrasound that we use and love is a perfect tool for this. We're going to be evaluating a bunch of different things, her heart rate and rhythm, and then what part of the heart sounds we hear the murmur during, either systolic or diastolic. And then based on that information, we're going to be imaging the chambers of the heart and evaluating whether we have valvular regurg, and if so, which valve and which ventricle that's receiving that blood, whether or not it's enlarged. So Dr. Gina is way better at ultrasounding than I am, so I'm going to kind of be her assistant today. Symphony is very sweet and well-behaved, but we need her to be really still for this. So we sedated her just a teeny tiny bit, and then the best ultrasound images happen when there's no hair through there. So I clipped a little spot on the left side. We may end up doing that on the right side as well, so we can get the best image. So my goal here isn't actually to clean, because our ultrasound is really easy to clean off. It's to eliminate the dead space created by air so that the ultrasound probe has a closer contact with what's underneath it.
So we have the lights down a little bit so Dr. Gina can see better.
I'm reaching underneath you, big girl.
Right. I'm sorry, I'm a little bit early. Here. I'm not getting like a really crisp image.
So you actually take a really accurate heart rate. Lub, dub.
I can't see any of the walls really.
You got a valve right there.
Yeah.
That should be aortic or mitral.
I think aortic.
Aortic?
I'm right on the pain.
Yeah. She's exerting a good bit of pressure. The equine heart is quite deep to the chest. And, oh, that's beautiful.
Can you turn it to color mode, Caitlin? Please.
So she's having to push pretty hard to get that really good deep view. Got a little bit of green.
Yeah. Quite a bit right there.
Do you think you're on mitral?
I'm facing more.
Okay. Cranially?
Yeah.
So when we're looking at this color Doppler, we want to see blue and red. The green indicates that we have backflow and mixing of blood, which commonly happens with valvular regurg. Mitral valve insufficiency is the most likely diagnosis based on the sound and the grade. And mitral valve insufficiency can have no effect on performance, but as it progresses, it can make the ventricle enlarged And so what we're doing today is we're evaluating how large the ventricle is and also evaluating how severe the mixing of blood is. I would call that mild to moderate.
Mm-hmm.
So that helps us determine not just Symphony's quality of life, but also whether or not she can safely be a pasture pet or be ridden and what degree of riding. And unfortunately, what's hard for us in these cases is the best way to monitor these guys are to serially ultrasound them over time. So in an owned animal, you say, hey, I'm going to schedule a farm call in 3 months and I'm going to do a follow-up ultrasound and compare and see if we have any progression. The way Horse Plus operates, we get horses in and we adopt them out and we're not really sure where they're going to go. So hopefully we can get Symphony to a home where she's going to have good follow-up, but we don't want to adopt horses out that are going to have major problems or require medication, or go to a home where a kid falls in love with them and then they have a shortened lifespan. So thus far, though, with what we're seeing in Symphony, I don't think that's the case with her. I think she's got good prognosis.
Okay, so they're checking on the other side of Symphony, on this side now.
Second huge gain. There it is, there it is, there it is. Beautiful.
You got a really floppy fellow right there.
Do you want color Doppler on?
That's definitely left-sided heart, because the right side's on the bottom right there. See, there's that green.
Mm-hmm.
That's right where I saw that thing flopping. Did you break a corday? That's what it kind of looked like.
Well, I mean, valvular prolapse has best possible prognosis. I'm not sure why. This is great. Can we always do imaging where I get to just lay on the horse? This is so comfortable. I feel very lazy. I'm just, this is the ideal set of circumstances.
Ventricles though.
Someone else is doing your, yeah, I do see it. Left? Yeah. So let's listen on the right again. According to those designations, it is every time, but it is the highest I would grade that is a 3. I would say it's 2 to 3.
So Symphony has some mammary development, so Dr. Lydia is going to do a pregnancy check on her.
I know you like to think, I won't sing. We all turn into our mothers, guys. It happens.
This not your first time?
So see all the peristalsis and movement. This is all GI tract. And I'm directly down. I'm over pelvic rim and I'm directly down. So reproductive tract would be laying right here, and we would be looking for a large or small fluid-filled structure. This is all GI.
Mm-hmm.
I don't see or feel any indications of pregnancy. Swooping over, different spot. Again, just peristalsis. Dr. Gina just finished ultrasounding Symphony's heart. I never shut up, and Dr. Gina's very quiet, but today I'm talking for her because she has laryngitis. I don't normally have an excuse for talking over other people. It's just my personality. I'm working on it. So what we determined with Symphony today, and as a qualification, neither Dr. Gina nor myself are cardiac specialists. We study cardiology in vet school. It's one class that we take. And Dr. Gina actually found a really cool CE. So before we looked at Symphony, we reviewed someone else saying the sounds out loud. So we feel pretty confident that she does have a systolic murmur that is most consistent with mitral valve regurgitation. The mitral valve, as horses age, gets weaker and basically doesn't close as crisply, so you can have some blood flow back into the ventricle. And we were able to document that flow phenomenon. In the left heart, from both the left and right sides of the heart. So it's a little bit confusing, but the way the heart is oriented, you can kind of see both sides of the heart from both sides via ultrasound. Mitral valve regurg is a condition that doesn't affect performance in most horses, and lots of horses with mitral valve regurg have a completely normal life expectancy, but there are cases where it progresses and it can cause pulmonary hypertension, it can cause pulmonary edema, and it can predispose them to acute cardiac death. So usually in horses we have signs before that happens. Their respiratory rates will go up, they'll become exercise intolerant, they'll lose weight, they can develop plaques of edema that you can see from the outside. And we're not seeing any of those signs with Symphony today, so we are clearing her to go for a riding evaluation to see what level she is, if she's even broke to ride at all, if she's comfortable wearing a saddle, but we'll want to make sure that we clearly message to any potential adopter that she does have a heart abnormality that likely a lot of older horses have, and that it would be amazing if whoever adopts her has a veterinarian that has the ability to do a cardiac ultrasound. These are guys that we recommend that we monitor over time with an ultrasound, and there are also more advanced diagnostics that you can do for a cardiac workup. An ECG and echocardiogram is something that cardiologists can do. And again, we're just GPs, so we might have missed something or potentially misdiagnosed something, but Dr. Gina and I are very much on the same page in this case. Symphony's a very, very good girl. She's a lightweight. She's the opposite of Bo, who we sedated yesterday and had to resedate 4 times. So she's a good girl, and hopefully we can make sure that she is comfortable and get her to an adoptive home. We sent a lot of diagnostic test results out. Late last week, we got a lot of reports back today, and one of the patients that we got a report back on was Mickey. Mickey is a 3-year-old mini mule, and he's very cute and very snarky. We noticed that he had a little bit of some nasal discharge, so our vet team collected a swab and sent it off for culture at our lab, and Mickey cultured 4 different bacteria, but most of them were just considered normal flora or something that was just present in the environment anyway. Mickey does have strep equi zooepidemicus, which, if you've heard us talk about strangles, this is not strangles. That is Streptococcus equi. This is Streptococcus equi zooepidemicus, which, unlike strangles, which is a primary pathogen, this bacteria is considered a secondary pathogen, which means it's opportunistic. So it waits, and it really only tends to affect immunocompromised animals, animals that are under stress or have another disease process going on. So Mickey came in through our buyout program. He came from a slaughter auction, and he's young, and it is likely that he had another upper respiratory infection. Clinically, he's doing very well. We just rechecked him today. His nasal discharge is already resolving. So also importantly though, this bacteria that he cultured is resistant to 3 different antibiotics. So it is resistant to amikacin, gentamicin, and tetracycline. So the lab did tell us that there are 5 other antibiotics available that will treat Mickey. Part of our job, Dr. Gina and I, are to make wise choices for antibiotic use. So in this case, because it's already been 5 days since the symptoms started and he's already resolving with just basic supportive care, we're not prescribing an antibiotic for him at this time. A lot of bacterial infections are self-limiting, but in case he doesn't continue to improve and he needs antibiotics, we know what antibiotics we can choose. So we have an organization coming to look at some of our mules on Monday, and unfortunately we took Mickey and 2 of his herd mates off that list because he wouldn't be cleared for a health certificate in time. But we have quite a few other mini mules. They're just interested in mules this trip. We have quite a few other options for them, and I feel confident that Mickey will be back to being healthy and adoptable very quickly.
I came back outside, and Ryan has Bo in the round pen right now, and he's got a saddle on. I believe Bo's an Arabian, so he's got the Arabian face. Look at him go.
He's all right.
Both of them. Yeah, you feel like you're on a pony. You're like a big kid on a little pony. Is this first time?
Meanwhile, also over here, we have Haley working with Chance again, and she's got a saddle on him. Look at Chance, he's got him a saddle on. Chance, you're being a good boy. And Haley's on him.
Good boy.
Good boy.
That's a good boy. You did it. See?
Yay! Good boy.
Here, first sit.
Okay, I'm going to try it again. Good boy. Good job, Chance.
Why'd your butt drop? How do you feel?
Zora and Peaches are looking on, like, what is going on? They're like, what is she doing? So we're heading up to quarantine. They're gonna get ready to actually move the squeeze chute because we're gonna be moving it into the new climate controlled intake barn. So we're all gonna head up there and I'm gonna show you guys all the process. Okay, they're all heading up to quarantine. Jason's on the tractor and then we have somebody else on the skid steer. And they're heading up to quarantine. Justin's running over there to beat his dad to quarantine so he can get that shot for you guys in the members video. Go, Justin. Oh, there he goes. Wow, this is what the bottom of the squeeze chute looks like. Interesting.
I have laid the hydraulic squeeze chute over because we're going to try to move it today over to the new quarantine barn. We have a skid steer and we have our tractor, so we'll have to see. It's super heavy It's incredibly heavy, but we've got some heavy duty machines here. So let's see what happens, but it is super exciting that we are actually able to move it over to the new quarantine barn today. And interestingly enough, this section of this building was the first Horse Plus building built on this property when we moved the squeeze chute out here, because we didn't want it in the rain. So this building has served its purpose well, and it's one of those amazing steps towards finalizing, you know, the whole process up here, getting the new quarantine intake barn going. So super exciting. Let's see what happens. So if you put your forks under there, we can partially raise it. The whole thing's got to come this way, and I'm hoping it will fit through this opening here. I should have brought a tape measure.
Oh yeah, pretty close.
Ah, no problem.
Yeah.
This one loop would be my thought. That could almost just come out if it knocks it out.
Rip the wall off.
So they have to disconnect the hydraulics in order to pull the rest. So they have to do that real quick.
Yeah, can you shove it back in just a touch?
Jason's moving the scale real quick so they can make room and disconnect it.
I literally just fixed the scale yesterday.
Oh man.
We're gonna go grab some wrenches and more supplies. So this is what it looks like right now. There's the scale. They disconnected the scale. We still have the hydraulics attached. Those have to be disconnected. But this is what the squeeze chute looks like upside down.
Let's just move this thing out of the way. Let's set it on this post.
So Jason's going to stand up the chute so it can not be so top heavy.
Before it goes all the way up, let's get this chain off. Come on in. So I'm trying to keep up with the squeeze chute because we got a bunch of hydraulic lines here, so I have to make sure I don't run over them. I have to make sure they don't get stretched and ruined. So, stressful. Currently, based on the plans, it's going to be right against the wall there, but Tawny's on her way to tell us exactly where to put it.
There's Tawny.
I've been very busy working on my computer, getting a bunch of stuff done, but they brought me up to make sure this goes in roughly the right position.
And then another 12 foot, so it's going right against this bay.
Basically.
Yeah, cool. That's why we put the bathroom there, so
like
it's right in the way.
the bathroom, so you could see the kind of area. I think it was a little bit further forward, but we can adjust it. Just put the end of it next to this post.
Yeah.
Because it doesn't need to be a whole lot. Like, we need to be able to lead horses out of it. And that should be just...
Yeah. So, yeah, from here to here.
Just on that side of it.
Okay. Yeah, let's do that. Good. This, I'll hold it. You can jet back out now. Oh, wait, what? Ah, there we go. And then this way. It's getting done. It's getting done so good. It's amazing. Can I set it down? Yeah. That's what I call success. I think that went really well, really smooth. No damage to anything, except for the building we had to rip apart to get it out. But it's here. It's going to be here for years.
See how much room it has back there once it's tilted. All the mats fell. Can't imagine when it's nasty, cold, and rainy, and like we're in here doing intake in this climate controlled building. This is gonna be so amazing. We're so grateful to our amazing donor down in Florida who donated significantly to make this happen, and then everyone that donated towards that $50,000 match to continue to make this a reality.
So we have Harley and Marley together. They'll be going with High Forest. Oh, guys. And they'll be taking Joy. Sweet little Joy. I really hope she gets adopted soon at their facility. She's so sweet. And Flower. I know she already has somebody who's interested in her, so she'll be going too.
We're really, really excited about a donation. This all came together this morning. I had asked Chandra if we could get a trailer donated. And when we were down in Texas driving, I saw these trailers and I was like, you know, it would be so useful to have a trailer that's multi-purpose at our shelter, you know, when we're going and getting feed supplies and shavings. It doesn't all have to go in the back of Keith's truck. And Shonda's been reaching out to different businesses and we're really excited. This is like a $15,000 trailer and they deducted $10,000 off the price for us, just over that, and are donating a huge majority of this trailer. So we only had to come up with $4,000 for this trailer, and it's really going to be amazing. We've been using horse trailers for most of our moving things, and to have a trailer that we can use to move equipment and whatnot is going to be just amazing. So we have our new trailer here, and we're so incredibly grateful to this business for stepping out and donating. You know, we're able to give tax receipts, and we definitely want to show our appreciation. It's an awesome, amazing trailer, and we're so incredibly grateful for their generosity.
He's gonna back the trailer up over here where the other trailers are, and that's basically where it's gonna be kept. Over here, there's Jason waiting for him to kind of show him where to back up. But this is where it's gonna be. And it's gonna be really useful, especially getting all those shavings and everything.
I just leave it off because then you'll forget and it's like,
Wallace Trailers just mostly donated this. They gave us such an amazing deal on it. They donated over $10,000 off the price of this trailer. And this is a really heavy duty trailer. Like, it will dump literally anything we need to put in here, whether we're hauling materials, whether we're hauling feed, we could haul hay, we could haul just about anything in this trailer and it would have no problem dumping it. So can't wait to get it to work. But again, a huge thank you to Wallace Trailers for donating most of the price of this trailer. Absolutely amazing. And wow, what a great trailer.